But we begin in Ottawa, and the first steps today towards that national pharmacare plan. The Liberal government tabled legislation to set up the first phase of that program. It'll cover birth control and diabetes medication for every Canadian with a health card. Earlier, Health Minister Mark Holland explained why the plan will start with a focus on those areas.
There are more than 9 million women of reproductive age in Canada. That's nearly a quarter of the population. Unintended pregnancy can be a cause of a cascade of health and economic impacts, both for individuals and for society. Having safe, reliable birth control is essentially freedom, and it is safety. However, these costs continue to be a barrier. Today, we're taking action to remove that barrier. Talking about patients who are making a decision about whether or not they take their diabetes medication or whether or not they go and get the food that they need for their family. And what happens to that person who doesn't take their medication? Right? They wind up potentially with an amputation, with a stroke, with a heart attack. They walk out with potentially kidney problems. That's not just a matter of social justice. Imagine the cost involved in that to our health system. And I don't think that's the kind of country we want to have.
CBC's Janice McGregor is in Ottawa and has more on the announcement and how the new plan will actually work.
Essentially trying to pick things to start that affect a broad number of people. We've been talking about the 4 million Canadians that live with managing diabetes, the millions of others that sort of are in a pre-diabetes kind of risk state, may need these medications at some point. And then you heard Mark Holland there talk about the 9 million women in Canada who are estimated anyway to benefit from contraception becoming free under this program. So this is not like some fringe thing that affects only a couple thousand people. I think the intention on the government's part is to sort of use some early successes, hopefully, in proving the benefit of this, the popularity of this, as a firm foundation then to sort of build down the road. But of course, coverage is expensive. They are not starting with necessarily the priciest drugs out there. Although, if you look at the actual design of what's in this legislation and the things the government had done to date, probably important sort of as our colleagues come out of the technical briefing and we sort of go through what's actually in the bill that was tabled today. Important to understand there's a few different aspects to this. They are setting up what they call the Canadian Drug Agency. It's going to keep a national formulary, a list of drugs that the government sort of makes available to Canadians. They are going to be engaging in something that started off as an initiative at the premier's level between provinces and territories, this idea of bulk purchasing to save a lot of money. So this kind of central agency, the Canadian Drug Agency, would sort of keep the list of drugs for available in Canada and seek to bulk purchase that. And then of those kind of categories of drugs on that list, they're pulling out these two and offering universal coverage through a single payer system across the board to start. Now, separately from this, they're also offering some help to people who need more rare medications because of the nature of sort of a rare disease, if you will, or cutting-edge treatments, things that are very, very helpful for a very small number of people and are often prohibitively expensive because they are not rolled out in a mass way. There is a separate program, but also part of this bill for those people who do need sort of the help for the rare diseases and those unique kind of pharmaceutical solutions. So all these things, part of this bill, now they intend to pass with the assistance of the NDP. The perceived huge bill for putting in a universal single-payer system was, for a long time, the reason a lot of people thought other governments hadn't acted sooner. Finally, Health Minister Mark Holland there said that this could be about $1.5 billion to add these two classes of drugs. That will be very interesting to people to hear that cost estimate floated ahead of what we know will be a very detailed set of negotiations with provinces and territories across the country, all of whom have a patchwork quilt of different coverages, some of them that already sort of include particular measures for different age groups of people, some of them already covering contraception in certain ways, or certain kinds of contraception, or certain kinds of diabetes assistance. So he was really clear that he didn't want to give an estimate for a long time for how much this initially was going to cost ahead of those conversations. But this is a very different strategy they're using on pharmacare than they use with childcare. With childcare, they came out with a big pot of money, and then they went to the provinces and said, okay, let's work out deals for how we're going to spend this and how this is going to work in your jurisdiction. Here, they've worked with the NDP. They've said how they want it to work. They've said what they want to cover. And then they're going to the provinces to figure out sort of, I guess, how much money they need to make this happen. So a very kind of different strategy here, and I don't want to lose sight of that.
CBC's Janice McGregor in Ottawa.